So I'm an oncologist. I work with cancer patients across Otago, Southland, and we've got a growing population here in Dunstan, and there's a big need for people not to have to travel while they're getting cancer care. So we are very keen on making sure that we can provide a service as close to people's home as possible. When patients have got cancer, it's a really difficult time. What's really helpful to them is if we can bring as much of the service to them here rather than have them come all the way to Dunedin for treatment. So what it means is that we've got a connection with where people are being treated. So we treat people here as well. We've got a good link with the local staff here. And basically this is a fabulous hospital where I enjoy coming to Dunstan to see people, and I know it's a lot easier on patients. So people are going through a difficult time. They need every advantage they can get, and we know that we're helping if we come and see them locally. We also know that the staff here at Dunstan are going that extra mile all that time to help care for patients in their own district. We want to help and be part of that. So they've got a lot less stress when we are seeing them locally, when they get an intense treatment, which can sometimes be the case with chemotherapy. They're back in their own home, more comfortable. They're also more likely to have their own family support around them when they come for those treatments, rather than having to go so far. Dunstan's an excellent example of what a rural hospital looks like. They are there for their communities. We bring expertise from Dunedin Hospital to support the patients here in Dunstan Hospital. One of the things I love about Dunstan Hospital, it's so flexible. They look at what the need is for their community and they make the changes in quick time. It's a fantastic example of health done locally, done well. Everyone knows that the Central Otago area is growing rapidly. They're going to have increasing healthcare needs here. Dunstan's fantastically positioned to move into that space. They're going to need more funding. They need all the help they can get because they can do things well here locally. You want a top-class facility, you want the best people here to look after them. That way, people can get care close to home, they can get looked after well in their own district. If the Central Otago people want their care done locally, the best thing they can do is support Dunstan Hospital, because Dunstan Hospital is where it all happens. That's why I come here. Dunstan's my favourite hospital in the South Island. It's a place where they look after people to a high level and do it locally and do it well. You can get excellent care here in Dunstan, which can match most things that we can do in Dunedin. So we want to support that. So I'm one of many specialists who come up here from Dunedin Hospital to support locally. And as far as I'm aware, there's 45 different specialties that come up here, and we're all committed to making sure that people locally get the best care in their own hospital. So Dunstan's a model for how care can be done in a rural setting, and I can only see that need getting bigger. And what I can see is that this is a place that can develop into a truly top-class hospital for a bigger community.